Redditors in healthcare, what is something you never thought you would have to tell another grown but human? Number. I cannot tell the race of your baby on ultrasound. You'll have to wait until birth to have an awkward conversation with one of your boyfriends. Pretty frequently have to explain to patients that they can't have metal on their bodies during an MRI, even if the jewelry whatever is on a different part of their body than what is being imaged. But I'm only getting an MRI of my foot. Why do I have to take my earrings out? Because the magnet affects the entire room, and it will rip your earrings out and throw them around the room. Also, people who have pacemakers who are peed off when we don't let them have an MRI, because they think it won't be any big deal. Sorry, I know you really want the best possible imaging for your back pain, but we really don't want to kill you to get it. Really, doctors need to be screening their patients for things like that before scheduling them for an MRI, but you'd be shocked how much it happens. I know you are trying to help, but you don't do CPR on someone who is actively telling you to stop between compressions. Shut up, I'm trying to save your life. Why showering regularly is important. I am a home health physical therapist. It wasn't till I started using Reddit that I discovered just how many people don't realize you have to wash your butt. The water trucking down during the shower isn't enough. Paramedic here. I had a PT once who was complaining of being unable to sleep. He's telling me all these different things he's been trying in order to sleep. You know, basic things like counting backward, counting sheep, melatonin, NyQuil, Benadryl, Zquil, warm milk, alcohol, weed, and M. This has been going on for about 2 weeks. Wait a minute, M. So I proceed to ask how long they've been on M. I started like 2 weeks ago when my GF showed me. At this point I thought this 47-year-old man would catch on. But nope, not even a flicker of a light bulb. So I say to him, you realize M can cause insomnia? It was as though I removed a bottle of stupid juice he was drinking and opened up a can of Acme knowledge, because he responded, oh my god, that makes so much sense. Cause I was even smoking M to try and sleep. Yeah, this productive member of society went straight to the waiting room. Yes, you smoking in your house is likely making your kid's asthma worse. My mother-in-law went off on me for giving my 12-year-old brother-in-law ice cream after dark, but he has asthma. You'll give him an attack. Cut to 5 minutes later, we're all in the living room and 2 people are smoking. Yes, it's the ice cream. Don't hide bottles of 5-hour energy in your bag. My PT came in with a complaint of vaginal foreign body. Doc goes in to do the pelvic exam, pulls out an opened, sealed bottle of 5-hour energy. Cue her explanation of hiding it from her spouse because he doesn't like for her to drink energy drinks. Then she asks for it back so she can drink it. It's not a pocket. Don't douche with bleach. Patient had mixed bleach, fabric softener, Dawn dish soap, vinegar, and some water, just in case, and burned the bejesus out of herself after having a baby 3 weeks prior because she was convinced people could smell her. She douched with it multiple times and came in when the burning toned down, sent off to gynecological surgeon and never seen again. Intercourse makes babies. Okay, so maybe not as succinct. You would be shocked at the number of calls related to abdominal pain turn out to be pregnancy even after asking the patient if there is any chance they are pregnant and they answer number. Older man, terminally ill, New Year's Eve, presented to the ER in the company of an escort. He had a finishing nail in his erect dong. He was into penile sounding. He says, well, there was nothing else laying round, and I'm so fricked up and can't feel a thing. Indeed, he was fricked up. Coke, alcohol, MDMA, Viagra and some hydrocodone. Poor dude just wanted one last Rager. I told him, wood is just a euphemism, man. Don't shove sharp things up your pee hole. He took it in stride. He was in the hospital for 2 days. The escort basically stayed with him the entire time. Come to find out, she was only one of the 3 escorts he had paid. She wasn't even the one who shoved the nail up there. I thought it odd that she hung around until he told me how much he had paid them. Turns out the other 2 were hanging out at his house waiting for his return. I visited him before he was discharged. Dude pops some X right in front me and says, just getting a head start. No more sharp crap, I promise, doc. I worked in hospital administration for nearly 2 years. While working on something I decided to take a break and go down to the cafeteria to get something to eat and not look at number. While there, a woman was on the phone with someone and was pretty openly talking about how she kept drinking the night before surgeries to calm her nerves and how she thought it was ridiculous that the doctors wouldn't just pump her stomach so they could get the surgery started. Now I don't know all of the details on what she was getting done, nor was I there for her presumed tirade on our doctors as she was prepped for whatever it is she needed done, but I am grateful I wasn't. She continued this conversation for probably a minute with her friend, completely oblivious to how ridiculous she sounded. Don't lick your contact lenses to clean them. Seriously. I work in health information management currently. I get to explain to parents that even though they are biological, I still can't share information about your adult kid about a half dozen times a day. Nurse here. I have to explain daily to patients that they can't eat before an operation. They're always saying things like, but if I ate and had an accident wouldn't they operate on me? I have to explain that in case of life and death situations the doctor takes some risks, but why risk during a routine operation? I worked in obstetrics for many years. I was taking care of a woman in her late 20s, definitely not a teen mom, married, with a job. She got to 10 centimeters, so I did my usual speech about how to push effectively. She nods and pushes when I tell her and she did great, really moved the baby down. I'm excited but I notice she's whispering to her husband. He looks at me and says, so why did you want her to do that? I was a bit taken aback and very slowly explained that she had to get the baby out. She asked if I was kidding. At this point I feel like I'm the butt of a practical joke, but it didn't stop. He kept asking if there wasn't a better way to do it and muttering that I was being ridiculous. She continued to push and thankfully didn't take long because she kept rolling her eyes at me. I was thrilled to hand this lovely couple off to the doctor. They looked slightly more convinced when he told her to do exactly what I had told her to do, and then a baby magically appeared. If she'd ended up in a C-section, I'm sure she'd have been convinced I had done it all to torture her. How does a woman make it into adulthood in normal society without knowing you have to push a baby out? And then there was the time a woman got mad when I told her there was absolutely no way we could do her cesarean laparoscopically. Literally every show movie that depicts women giving birth has this exchange. A few minutes of, nurse, push, push, pregnant lady, I can't push anymore. Nurse boyfriend whoever, yes you can. One more push. Baby, whatever. No, your teenage daughters cannot share a single prescription for birth control pills. You need to wash your hands. Don't frick your wife's colostomy hole. It's been years since I learned of a new fetish, so thank you. I took care of a paraplegic as a home health RN. She was young, and she was attractive. She lived with her boyfriend and kept getting UTIs. This isn't uncommon. She had a catheter and it's something that can be very hard for this population. Well, this patient was talking to me about her intimate life and told me her boyfriend liked anal. She has no feeling below the waist. Then it hit me. I asked if he's going from anal to vaginal. She said she wasn't sure. So I went and asked him. I had to tell them both that is probably what is causing her UTIs. They can't go from anal to vaginal. So, that's what I charted patient education was that day. I had to call her urologist and primary care to let them know we probably found the issue. We all tried to be professional but there was lots of awkward laughing. Usually goes along with after a car accident and their kids weren't in car seat belts. How their kids need to be in freaking car seats. But it's summer, so a more seasonal example is the following. Me, so what's the problem today? Them, I don't know what's going on. I can't breath. I'm having a seizure. Me, hum. Has this ever happened before? Yeah, usually when I smoke crystal M. Me, did you smoke crystal M today? Yeah, like 30 minutes ago. Why? Me. Patient had been referred to my pharmacy by his physician for an OTC enema. The guy was not the sharpest tack, and apparently either his physician did not explain it well or the guy didn't listen. But our conversation went like this. PT, so I drink down this whole bottle and then I'll have to crap? Me, no sir, this is an enema. It is used rectally. PT, confused. So what's that mean? I don't have to drink the whole thing. Me. No sir, you'll lie on your side and insert the applicator tip of the bottle into your rectum and squeeze the contents into your bowel. You'll then remain lying on your side and hold the enema in until you feel the urge to have a bowel movement. PT. You telling me I got to stick it up my butt? Me. Yes sir, this is an enema and it is used rectally. There are detailed instructions and diagrams in the box. PT. Frick you. And he stormed off. That was the last I saw of him. Not sure if he thought I was messing with him or what, but I hope he eventually got to crap. Well, conversely, when I got the prep stuff for my colonoscopy, the pharmacist made it a point to tell me several times that it was an oral medication and not a suppository. I can only imagine what precipitated that one. Worked in an optical practice in the UK. Man comes in complaining of bad vision. His astigmatism has increased by like 3 diopters. That's a frickload and definitely shouldn't happen. Optician retested using different kit. Same result. Told him to come back in a week and we will retest it. This time we're looking at 4 diopters. They freak out. Recheck again. Another optician checks it. Same result. They run through health, smoking, drinking, medicine. Nothing out of the ordinary. The guy looks stressed as crap. Put his head in his hands and put his thumbs against the side of his eyes. The optician asks if he does that a lot. Apparently whenever he's stressed he pushes the sides of his eyes. He's done it so much that he has physically changed the front of his eyeball and ruined his vision. We told him to stop doing that. Never thought we'd have to tell another human being to not squeeze their own eyeballs. Also had to tell a kid to not look at laser pointers. But he was just dumb as crap. I don't know how much pressure is required to create this problem, but now I am paranoid about rubbing my eyes. Old friend of mine is a nurse practitioner. She told me she once saw a patient, male, complaining of severe rectal itching and general pain. She is a very smart people person. She can read people very well. She got right to the point and asked him about his daily hygiene routine. She had a hunch based off his presentation that he was a man's man. Ain't no gay stuff happening here. Long story short, when showering, he never cleaned his butt, ever. He told her that it was gay to touch his anus. She had to explain to him that the severe rash and itching he had been dealing with for apparently years was a direct result of his perceived homo acts. She instructed him to go home, take a proper shower, and apply witch hazel for a few days. Amazing that a grown man thinks this way. I'm amazed by the logic that it's gay to wash your crack but somehow not to touch your own dong. What's an appropriate reason to dial 911? Private ambulance services. No, it's not okay to call 911 because your boyfriend won't take his jacket off. And no calling us directly. Private ambulance isn't appropriate either. A lady in my building called 911 because her son had nasal congestion. WTF. No, belly button lint is not a reason to go to the emergency room via ambulance. You're 22, wash your dong. That you need to take the packaging off the suppository before you insert it, which in retrospect, is why they were making his piles worse. When I worked at CVS it was our policy to change insert to unwrap and insert on all pre-generated suppository instructions. Me. Do you have any medical problems? PT. Nope. Me. Do you take any medications? PT. Yes. I take metformin, levothyroxine, Coumadin, metoprolol, Cialis, etc. Me. So you are diabetic, have thyroid issues, take a nully blood thinner, have high blood pressure etc. Question mark? PT. Well no, not since I started taking my meds. I had to tell a patient that food cooked in restaurants does in fact have salt, sodium. He was under the impression that they just didn't IDK. I was like, no dude, that's why their food tastes good. Me. Did you miss a dose of insert medicine name here? PT. No, I take it every day. Me. How many times did you not take previously named medicine in the past week? PT. 3 and I skipped this morning too. This happens probably once a week. The amount of people who skip their diabetes or hypertension meds because they don't feel hyperglycemic or hypertensive is mind-boggling. The 3 that come to mind for me are 1. trying to explain to a patient why it probably wasn't a good idea to eat a container of cottage cheese that had been sitting out on the counter all night. 2. The entire family of a lady with a pacemaker. They kept insisting that she did not have a history of heart problems. They were convinced that because the pacemaker helped her, that it meant she no longer had any kind of heart problem. 3. Family with a mom that was 650 pounds. And if they wanted to move her anywhere, they would have to call the fire department. They were always apologetic and such and said they just didn't know why she was so heavy and that she's tried everything to lose weight, but all around her bed is nothing but Butterfinger, Babe Ruth, Reese cup packages, fast food bags. I'm like, she can't walk on her own. Bring her a salad. All this junk and no movement is why she's so heavy. My mom is a nurse and had to teach these parents how to read a clock. Their baby wasn't eating enough because they didn't know when it's time to feed him. It's not okay to crap the bed just because you don't want to walk 10 feet to the bathroom, said to a fully coherent and independent patient that decided she would rather just have the staff clean her up and change the sheets. Wife had a baby. The process involved about 100 professionals telling never to shake my baby. Of course, I thought, everyone knows that. Wife's water breaks. We are in the hospital, and she's getting checked in. I'm there with 2 other soon-to-be fathers. A nurse comes by and almost casually starts giving us a basic rundown of what not to do. Stuff I've heard 100 times. We get to never shake your baby, and one guy looks confused. A bewildering conversation takes place where this man insists he's never heard of that. Must be cultural differences. Insist everyone where he came from was shaken, and eventually is led away to talk to the doctor. I never saw him again, but I'm still scared for that baby. Pee does not come out the vag. Pee is stored in the balls. We all know this. I took on the nurse role at a camp once and had to tell a bunch of kids not to put hand sanitizer in their urethras. To a girl once that she needed the morning after pill because she thought that girls only have babies if they think really hard to have one. That's some wishful thinking right there. A couple instances come to mind. 1. Don't have intercourse 6 hours after you delivered a baby. 2. Coffee creamer is not the same as infant formula. Please do not feed your day-old newborn International Delight. 3. Probiotics are different from antibiotics. Probiotics do not cure syphilis. I am a clinical lab scientist, and I frequently have to tell patients that I cannot accept their stool samples in Tupperware, mugs, food to go boxes, etc. The worst is when they take the crap-filled mug back home with them cause they don't want to lose a perfectly good mug. Yes, you are pregnant. I'm holding a head with my hand. As she's screaming it's not possible. Mum saying the same thing. As she called her mum. Guess they found out it was possible. Had a partner try to threaten to take our patient out of the hospital because she was in increasing pain and we weren't stopping fixing it. Note, she was in labor and minutes away from delivering. Had to explain that leaving now would not help her pain as it's normal to increase as labor progresses, and by leaving we would have to remove the epidural and that would definitely make pain worse. Note, we had zero plans of actually doing any of this, but still had to point out how stupid his logic was. There was no way we would let someone who's about to deliver to walk out. Like close enough we checked between legs to make sure no surprise baby on the bed level close to delivering. Luckily her mom showed up a few minutes later and very quickly put him in his place. He tried to brag to her about how he was threatening to leave, going for tough guy macho type persona, and she told him to either shut up or wait down in lobby. The number of guys I've spoken to who genuinely think that a woman in labor goes immediately to hospital where they completely and instantly stop all her pain and get the baby out within a few minutes is disturbing. Nurse here. The number of people I've had to tell to not drink or to stop drinking their urine is surprising. You have been visited by the romantic doggo. Comment love is magic so you never fall in the friend zone. If you are new to the channel, you can subscribe. I publish new videos every day. Until then, check another video, or don't. Either way, have a great day you magnificent people.